So yeah, that's my first thing is thank you guys for coming on a Saturday. I really appreciate it. It's a dry Saturday so far, so that's huge. It's enjoyable.
Do you want to just explain your background a little bit?
Yeah, sure. So I'm a physical therapist. I'm originally from California. I moved here about 5 years ago. And one of the things that I haven't done since I moved here is really gotten into the community. So when I decided to kind of start my own thing, one of the things I wanted to do was get incorporated in the community again, give back to the community, get involved. And I think one of the benefits of COVID has really been a re-emphasis on health, right? A lot of people are more encouraged or more motivated in prioritizing their health. And so one of the things that I want to do is facilitate that. And one is facilitate that through gyms that I like and I want to support in the local community. And then also just educate you guys here. That's my area of expertise is educating on different issues, right? Whether shoulder, back, knee is kind of what I kind of typically target, and find some simple things that we can kind of do in order to help you feel better, move better, perform better, all that stuff, continue training. That's what I want, right? So that's the emphasis of working in a gym like this or being part of a gym like this is to encourage you and facilitate you staying in here. Because what happens, people that drop off, it's because they have a nagging injury, right, that they don't address. And then they're like, I just can't do it anymore. My hip hurts too much. And then they disappear, right? And so I don't want that to happen. So that's kind of why I want to do this in conjunction with some gyms. And so the other thing with this that I really like is that I'm working with proactive people typically, right? Because you have to be proactive if you're here, right, about your health. Or you're proactive because you're part of PDX Fitness. So those are the type of people that physical therapists want to work with. We don't get to work, most of our patients are not proactive in the general setting. And so in this situation, I get to interact with like-minded people that want to be proactive and care about their health, okay? And I think one of the big things one of the great things here is we're starting with low back pain. Everyone can kind of relate to low back pain. We've all experienced low back pain, or we know somebody that's had really bad back pain. And once you've had really bad back pain, you never want that again, right? That's scary and freaks you out, right? So you modify your activities or you avoid certain activities and things like that. And maybe you went to PT or a chiropractor to help you facilitate that or figure out what you want to do or what you need to do. But most people, they just don't do it. Like, oh, I don't bend anymore, right? I hear that all the time. Well, I was like, you are bending, right? You're bending to pick stuff off the ground. Right, so you have to do those things and getting you comfortable again, or why aren't you comfortable? What can you do if you do exacerbate it? Finding some of those easy tools is not that hard. It's not that complicated to find as long as you do it. But the problem is when in the instance when it happens, you're locked up and you can't move and you're freaking out. Like, am I ever going to get out of this? And that's a scary thing. And so I tell people a lot of times now with back pain is you have to think of it like inflammation. Right, like any other joint in the body, we just treat it differently for whatever reason, because there's a fear, and I think it's so central, and there's a lot of nerves, but it's no different than any other joint in the body, right? If I hurt my elbow, it's not necessarily different than my back, because what happens? It's just inflammation, right? The injury to the back in that acute setting is typically inflammation. I'm not saying it's not a disc herniation, a disc didn't protrude out. I'm not saying that the vertebrae is not out of place. That may very well be true, but in the moment, that doesn't matter. In the moment, that first 24, 48 hours, you just got to figure out what you can do to feel better. And so if I treat a joint, or if I have an elbow, this is my example, right? Bang, I hurt my elbow for whatever reason. Inflammation, swelling, right? Pain, lack of movement in some capacity. Okay, so if I test it, you're like, oh yeah, bending, that hurts, that increases my pain. But hey, I can straighten it. I'm like, cool, do that. What you're not gonna do is this, I gotta bend it again, right? That's not what I want you to do. So the same is true for my back. If I hurt my back bending over, let's say doing a deadlift, I'm not gonna go back and just do a bunch more bending exercises because I'm trying to bring it back. What I'm probably gonna do is go the opposite way. Hey, I can move this way. Because what does movement do for us? Movement is blood flow, right? Movement is nutrients coming to that body, healing properties coming to that area. So we don't wanna just brace it and not move at all, but we have to figure out how to do that, and that's super important. Okay, does that make sense? So I think that's a really important concept when it comes to back pain is I don't want you completely afraid, but I know what you're going through, right? I've been through it. I actually did it last weekend. I went down in the gym playing with my son, bent over, rolling a ball, and I got locked up. First time in my life. And I was on the ground, on my hands and knees, saying, oh fuck, how am I gonna get back up? Right, I'm around all these parents and I'm freaking out, right? But as a PT, at least I know what I need to be able to do. I know I need to get upright and all those types of things. And so I think, yeah. So that's what I want to take away that fear a little bit, because if you know what to do, it helps a lot to mitigate that inflammation. Don't think about it about a disc or a herniation or a subluxation of some sort. Think about, hey, it's a movement, it's inflammation, and I gotta calm it down. And I gotta do whatever I can to calm it down. And so that, which is kind of challenging in the acute setting, but that's kind of the goal. And so I think that's important. The other thing here is, in the current environment that we're in, right, we have a lot of influences on what we should be doing for back pain or for back health or whatever. And you have the internet, and WebMD gives you all these different things of advice, right? And you have social media, and you have all these influencers or just people telling you what to do for low back pain. The problem is they're all generic. You don't know if it applies to you. And most of the time, it's the craziest thing that you can do on social media that looks cool and will grab your attention. It's not necessarily something that's going to be beneficial. You don't know that, right? And at the end of the day, in terms of the way that I approach treatment, and one of my main mantras is simple things done incredibly well, right? So it's not about the craziest exercise. I want to give you the boring stuff, because at the end of the day, the people that do a good job with their health, that they stay fit consistently and all that, they're just doing the same stuff every single day. They figure out what works, what they need to do, and they're going to do it a lot. That's the key. It's not about the variety. It's not that variety's bad. You can do that, but you should be doing the basic stuffs consistently and doing them well. Okay. Okay. So so the other thing that I want to touch on before we get moving is I always get the question of Pilates and yoga. Is it good for you? Is it good for your back? Right. And the question is, or the answer is, it depends. Right? It depends on who you are. It depends on your history. It depends on your back and what you can tolerate. Because some people are going to do this, right? And they're going to do it a bunch of times and I feel great. Other people are going to do this and they can't walk for 2 or 3 days after, right? And the same is true for Pilates, right? You go do a Pilates session, people love it. It's a great core exercise, no doubt. But some people go do it and again, they're hunched over. They're like, I can't figure out what I did. Like for you, I would not give you Pilates. I would say, don't go to Pilates, right? So the idea is, and I think what's really important with Pilates is it was created by Dr. Pilates 70 years ago or whatever. I don't know when it was created. But he created it with the idea of combating stenosis, right? So as we age, we develop extension sensitivity and stenosis. That's sensitivity to arching. So that's why you see a lot of people as they get older, they start to hunch, right? It's not because their posture is bad and they're weak. It's because they're sensitive to fully standing upright. So what is Pilates? Tuck you under from here, and now I'm fine. I'm decreased that extension in my back, and now I can tolerate it, and I'm more free to move that way, right? So that was his idea, and that's great if that's what your issue is. But if your issue is a disc issue, you're probably not going to like it. And I've had plenty of people kind of re-aggravate their backs because they went right back to that. And maybe 6 months or a year after you initially do a disc herniation, you can do that. Right, but that first 3-4 months, you probably can't. And if you like Pilates, I'm not saying don't do it, or yoga, don't do it. But go to somebody that understands the modifications that you need, because not everybody can just push through those types of things. And so that's why you see a lot of PTs nowadays, they are yoga instructors or they are Pilates instructors because they know how to modify. It's a popular, exercise routine, but it's, you have to be able to modify 2 people. And back home in California, I used to refer to a Pilates instructor all the time. She was a PT/Pilates instructor. She had her own studio, and she was really good at modifying it and getting people moving and training. So again, it's not good, it's not bad. It just depends on who you are and what you need. Okay? Any questions on that stuff? Clear? Cool. All right, so now we're gonna kind of do some of our demo do type stuff. So again, what we're gonna do, self-assessment. We're gonna do one at a time. We'll kind of go through it as a group if we can. It's pretty easy. And then we'll go through some exercise. One exercise, we'll try it again. We can just kind of go back and forth. There's only a couple of you here, so it's be pretty quick. So what I'll have you do is just go ahead and stand up. And this is on your handout, kind of how I sequence it, so you can always refer to it if you want. And again, I'll send you this with links later, kind of thing. So again, just be cautious with this. If it does, fine, right? If you start to feel some nervy stuff, not what I want, we got to modify a little bit. So all these things that we're kind of doing, just kind of nice and easy, go through them in that sense. So I'm actually going to bring one of you up. Why don't you come up here? Because I hurt my back last week, so I do not want to do this. All right, so you just go sideways for me. So what we're going to do is just a basic toe touch when you kind of touch the ground. Not yet. So Don't feel bad if you can't touch the ground. That's not the expectation here, okay? But what I want to do is reincorporate. I don't want to toe touch where my butt goes way back like a hinge in a deadlift, and then I go back. What I want is a segmental kind of flexion. So it's chin down, neck down, shoulders, upper back, and you're just gently collapsing over yourself there. And so my legs are kind of staying upright. Does that make sense? Can I do that? So for you to do it, so chin tuck your head down. Yeah, neck, shoulders, upper back, mid back, lower back.
That's not my problem. I'm afraid of all over.
I'll push you back up. Good. And then come back up. Good. So what you should feel is some sort of stretch on this backside, right?
Yeah.
Okay.
Yeah, mostly.
Yeah. Okay, I believe you. Okay, so why don't you guys do that and try it. So feet kind of are going to be kind of hip width apart. I didn't mention that, right? So standing nice and tall, you're going to chin tuck, head, shoulders, upper back, mid back, low back, hips. Okay, and just kind of take inventory of how far you get or what that feels like on the backside of your legs, on your lower back. Okay, and then come back up. All right, so now, so we have the seats. So actually, I'm gonna have all of you guys have a seat on the chair. So you go sideways, so you could sit here, sir. Jim, Ron, Jim. Okay, so now we're gonna do the same kind of toe touch sequence, but in sitting. So all you're gonna do is you're gonna basically take your hands to the ground between your feet. And so what I'm looking for here is a relaxation on the backside and a stretch, right? And ideally, if you can, how are you with that? That's okay. Yeah. Okay. So actually, so you'll be a good demo. So go ahead and put your hands on the ground. Through there. Yep. And then what I want you to do is keep your ribs like on your thighs if you can, and lift your butt up in the air.
You can't do that.
There. Yeah. So can you push your palms in the ground?
Yeah.
Yeah, like that, and then back down. So just kind of rep that a few times. Now, is that giving you pain, or are you okay?
No, that's okay.
Okay, so you should feel kind of a stretch through here,
Yeah,
this region. Right, so this is a really good one. Again, kind of like the Pilates concept of stretching out that backside. Right, so people that are very extension sensitive, this is a really good one as long as you're not getting kind of nerve irritation.
Yeah, that's good.
Okay, so good. So now retry the toe touch after doing that. So now you just stand again, and we'll go back to flexing down. So it may be a little bit better, it may not. Either way, it's okay. Oh, you know what I need? We're gonna go. Cool. So just, again, take inventory of where you are.
Thank you.
And then I want do you have like little plates? We're basically gonna, yeah, for the toes.
2.5 or 5?
5s would be perfect. So 2 for each. Sorry. So this is going to be a review, basically just doing the toe touch we just did, the test we just did, but I'm going to facilitate it a little bit. So what we're going to do is we're going to put our toes underneath a plate. We just want to elevate it so at home it doesn't have to be a plate, obviously. Just anything, it could be a little book or something to help get your weight off your toes. Okay, so what she'll do, actually, not yet. You're excited.
He is.
Okay, so we're gonna put this between your legs. It's not weird, okay? You're gonna gently squeeze that foam roll, okay? Weight's gonna be more on your heels now, right?
Right.
And then now do the same thing. Now we're gonna slowly collapse, nice and controlled, going down. Okay, and then come back up. So we're just gonna go up and down. Every once in a while, check in, make sure you're squeezing that foam roll. You guys doing okay?
Yeah.
This is adorable. This is cute.
Breathe.
I hope one day me and my brother go to a workshop together.
They work out together.
We do a lot of things together, so
Yeah.
we have a good moment.
So it should, with each repetition, get a little bit easier, right? It shouldn't be increasing in discomfort or anything. If it is, let me know. But it's a new thing, right? It's not something you're used to where you're shifting your weight back into your heels.
Right.
That's one of those things that most people aren't typically doing. So we'll do a few more.
Squeezing too hard.
Oh, that.
Nice. All right, so now we'll kind of get rid of these things. All right, and then toes off the plates there, and then retest your toe touch again. So hip width apart, and just kind of gently go down and see what you got. Right? So easy. So again, as something as at home, this will help you move better, right, in terms of that toe touch and flexing. And just kind of, you can do both of these if you want, just like we did back to back. If you're like, hey, one helped more than the other, or I like one more than the other, do that. And maybe you just do that a few times, either way. Okay, so whichever one, I just want you to have a feeling of what those changes were and which one you felt kind of gave you a better movement afterwards. All right, so let's get this out of the way so you guys don't trip.
Work your fingers.
Do we need them again, or are you good?
No, that's it, sorry. Okay, so now the next test is gonna be with dowels. So here, any questions on that last one?
No.
No, okay. So, the dowel, which you guys have probably done in here before, is just to make sure that I'm maintaining alignment. So now I'm gonna look at extension. So we just looked at flexion. Now we're gonna look at more kind of like the arching back, but more focusing on the hip, because that's what matters, right? If I'm gonna walk, what I need to walk comfortably is adequate hip extension. And if I don't have that, guess what I do?
Yeah.
Right? I go through my back. So, what the dowel is going to ensure is I'm gonna make sure my butt, my low back, roughly, and my mid back, upper back are all staying in tune or kind of tight to this. So when I do this test, what I want is just tighten the abs a little bit and push that hip forward. And the question is can my knee get behind my hip, right? Without dumping into extension. Because I'm sure you could do this and it's gonna be great, right? So if you tuck your butt a little bit underneath you and then push forward, can I get there? Okay? So nice and tall first. Yep, so keep that together. So you almost just push through where your hand is, your sacrum, to push forward. And my guess is you don't go too far, especially you two guys. Maybe, yeah, so you can go a little, you're pretty good.
My experience is.
You've lived a life, like you said. Okay, so again, notice what you feel, right? Just kind of go back and forth a few times, and my guess is a pretty good stretch in the front.
Right.
Right?
Quads, yeah, no problem.
Yeah, good.
We got that surrounded.
Okay, and then why don't you, since you're down there, why don't you compare to the other side?
Just switch knees.
Correct, yep. You can do a flip if you want.
Reason I'm a little delicate on it.
Do you have a total knee?
He's somewhat damaged.
Do you need a mat, Jimmy?
No, I just got a cramp.
Oh, okay.
Oh, that's all your muscles are showing up there, Jim. That's why we go to the gym.
I got a knee replacement because I was up skiing and crushed my ankle, which tore up my knee.
Hit him again,
So
Jim.
that whole right side of my body is kind of screwed up.
Gotcha. When did you get your knee replacement?
About a year ago.
Oh yeah, so it's probably still pretty sensitive to kneel on.
It's been 2 years at least.
So, you know,
See, I crushed my ankle
Yeah.
in 2011.
Okay, so notice the difference. It's probably pretty similar for most of you side to side. Okay.
And I did notice that the knee was hurting because my ankle was hurting so bad. So when I finally got, I didn't walk for 6 months. I was unable to walk, put weight on that foot.
Okay.
The doctor didn't want me to.
So this next one might be a little hard for you. We'll modify it for you though. So what we'll do for you guys is we're gonna do like a quad stretch, right? Pretty crazy. This is stiff.
Yeah.
So again, normally like my go-to is the pretzel, which you could totally do, right? Into there. But with you guys, I think what'll be easier, one, I can bring my knees up, right? And this will neutralize my pelvis. And then I'll just take my top leg, and I might have to get like a band to assist to grab that leg for you to bring you into that quad stretch. So, hold on, Jimbo. Coming.
Yeah.
I got you. Okay, so actually, let's do it this way. Hold on.
We could set it out here to the incentive, right?
So let's try that. We might have to put it around your ankle. Okay, so then you could pull there. And so the idea with this one, and I like doing it this way, is I want you to bring this knee up though, before you go, right? So if I can bring his knee up to roughly hip level, that's gonna keep my pelvis neutral, as opposed to stretching into that quad and arching, which there might be some sensitivity to. So what I want is you're gonna roll forward towards me. Okay, that knee's as high as he can comfortably go.
Yeah.
And then what I wanna do is, you're just gonna think about pushing that leg back. So squeeze that butt, push that hip forward as the knee goes back. When I'm stretching, more isn't better, right? I'm not trying to go super aggressive here, especially for him. So all I want him to think about is just breathe, right? Get in this position and five deep breaths. Yeah, sure. So I'll just talk you through it. So lay on your side. And then we'll go this and that. So for you, it's just the opposite,
Okay,
right?
gotcha.
And then this hand holds this in place. Yeah, going through there. Yeah, exactly. And then tall spine, rotating back. And then you're just thinking about squeezing the right butt cheek forward there a little bit. Right one, yeah. So you should feel a pretty good stretch today, right? And then same concept, 5 deep breaths. Okay, so on your own a little bit, or as we help you.
Chase, he needs a little assistance.
Okay.
Probably a little bit more than that. You got a sledgehammer out here?
So what do you feel there? Nothing?
His arm.
Okay. Roll forward first. And then what I want you to do is I want you to think about using this hip, so keep yourself closed, and then bring that knee back. So you actively do it. So I want you to use your hip muscles.
Yeah.
So don't worry about your arms quite so much yet. So just bring that back, right?
Just a minute. We're going to work something else out. How about that?
Okay. Still want you to roll forward.
All right, that's nice.
So what do you feel there? Nothing? Well, you probably don't feel anything yet.
You don't have the stretch for, oh, okay. And we're going to quad there? Hang
Yeah, correct. Yeah.
Very nice. Okay.
Okay.
No more nice cramps.
0 to 100.
Yeah, go slow.
Right. So the idea for you is you're over relying on your arms to do this exercise, right? And maybe you have to, but
Lovely.
what I want you to be able to do is be able to relax the arms first and get this leg back and then pull. Does that make sense?
Of course it does.
You know, or Jim's just gonna have to come over your house and stretch you every morning. You know.
Oh, that sucks. You've made a real gross assumption. He does not like to get up in the morning. So maybe the afternoon is preferred.
Okay. So now let's try the other side.
This is good. Yeah.
Let's compare.
I like what you're doing.
We had good effort there at least.
Yeah.
Yeah, I got a good coach. I like your little bit. Check it.
Okay. There, so bend, yep, first. Tall there, good. And then pull that leg back first, and then pull the arm. Yeah, there you go. See, Ron can do hard things.
Ron can visualize hard things.
Okay.
What are you doing over there, Pretzel?
Gadzooks, you're doing great. Very impressive.
And then we're going to go. I think two's good because these guys are not going to need it.
I got permission. Okay.
So you're going to use this. They're not for the next one. All right. Okay, let's get out of this one. That was fun, huh?
Yes, it was. As a matter of fact, it was refreshing.
That wasn't bad.
No? So for you guys, just because, well, let's go through the next one and then we'll talk about it. So the next one is, again, just like before, where the test becomes the intervention, right? So what we're going to do is you're going to put your front foot on that top yoga block to wind you up a little bit. I'm not going to make you guys do that. All we're going to do is the test for you two. This is my go-to hip flexor stretch anyway. So what I want you to think about, the reason I have her put her foot on the yoga block is what is it doing? She's bringing her hip, her leg up into flexion, which tucks her under naturally. So it makes it a lot easier to wind it up. So the key with this stretch is just the wind up and then get into it. The problem is I get people, especially like a yogi, that's like, I don't really feel a stretch, I'm super flexible. I'm like, yeah, that's because you're just arching again. Yeah. But if I tuck my butt underneath me and I tighten my abs and then I shift my hip forward, I mean, it doesn't take much for me at all to start to feel a little stretch. And not to say that I'm super flexible, but like it shouldn't, if you wind it up properly, most of us, especially if we were positive on these tests, can get that stretch pretty quick. All right? So feel free to get on one knee there, Ron.
Try getting with a program.
So I'll talk you through it. So at home, also you can be by a bench or like by a wall, table, couch, whatever, for balance. I don't want you to have to worry about balance while you're doing this necessarily, okay? So with that, why don't you, with one hand, hold there. And then hold.
Did you guess that I was going to have trouble?
Nah, not at all. Okay, so talking you through it. So first thing you're gonna do is just nice and tall, right? And I'm thinking my shoulder, my head, shoulder, hip, knee, all in one line, right? To start, this front foot needs to be out in front of me a good distance, so I want to be roughly 90 degrees here, right? Kind of in there. And then from there, all I'm thinking first, tighten my abs, squeeze my butt cheeks, push my hips forward there, right? Just shift my weight to that front foot a little bit more. And as soon as you get that stretch, you're good. You don't have to keep going. So once you get there, hold 5 deep breaths, okay? Doing okay, Jim? Do you want to, you need a pad?
This
Are you
one's
okay?
fine.
This one, okay, it's the other knee.
Wait till I flip them around. Oh,
Okay.
Line.
And then now switch. Do you want a pad? No? It's no shame, Jim.
No, I don't need it.
It's kneeling's tough.
Comfortable, actually.
yeah,
We've been
Just
working,
for you.
we've been working on that, Matt.
Yeah.
No, I
Okay,
know.
so nice and tall, abs are tight, you're gonna squeeze your butt cheeks. If you want, you can dig your front heel into the ground a little bit, that gets the hamstring going, and then you go shift forward. Easy, Jim, easy.
You smiling?
Yeah.
Yeah,
He can't, he's breathing.
that's a good thing.
Yeah,
When it gets all purple, I kind of look at it funny.
okay, so again, at home, something I would do is 2 sets of this, right? I'd run through it a couple times. 2 sets of 30 seconds or 5 breaths. So 5 breaths and 30 seconds kind of runs around the same time, okay? I like the breathing, 1, because you don't have to have a clock by you, and then 2, it's helping you relax, ideally, okay? All right, so now let's recheck let's do the test again. So let's get a dowel.
We got it.
Yeah. Well, I was scared to walk through you guys. Gatekeepers. Okay, so,
Not combat trained.
right? So from there, and then just gently kind of shift your weight forward a little bit, and just kind of see, does that knee go a little easier behind you? But again, we're still a little tight in the abs because I don't want to arch through your back. So you should not feel this, whether you're doing the test or the stretch, in your low back. Same with the one on the side where we did the quad stretch. That should not feel it in your back, which is why I had the knee kind of come up high.
Very excellent.
Yeah? Okay, and then let's switch the knees there.
Hits in the head.
Didn't anticipate being scared on this one. Good. So you guys notice a change at all? About the same?
It's easier.
Easier?
It's actually easier to balance.
Too? Yeah, maybe you got used to it too, yeah.
Yeah, well, every exercise in here, the second time around, it's always easy.
You're warmed up. Okay. All right, so the next test is going to be on your back. I'll take the dowels. Take the weapons away from you guys. Just take the weapon away from the Marine for sure.
Brother, we love you, know.
Okay, so we've gone through bending forward, so flexion. We've gone through an extension, range of motion. So now the next thing is a stability test that I want to do. So all it is we worked on motion hip extension. Now I want to see, can I stabilize in that hip, right? Why is that important? Because when I walk, I have to be stable into here, right? Because what happens if I'm not? I jut out, I come over, I drop, those types of things. That's what you see. Over time, that's going to be a problem. You do that for a full marathon, you're going to be hurting, right? So it's really, really important to kind of test that strength, which you've probably done some of this with the rehab for the knee, but we'll see where you're at.
It's been a long time ago.
So what it's going to be
Sleep between then and now.
is it's just going to be a bridge, okay? So on your back, what I want to make sure again is you're not just arching excessively through it or we're not rotating the pelvis. So what we're going to do is we're going to come up onto 2, and then guess what? We're going to shift our weight over to the left leg, lift our right leg up. And test 1 is, can I stay square or do I drop immediately? Because if I drop, it's done. So what I want to see is, can you do that for 30 seconds, right? So coming up with 2, shift over, hold. And what you'll see is as you fatigue, you're either going to drop entirely the hip, or you're going to twist.
Can I get a little cloth for my tears?
No, tears are good. It's 2023. Men can cry.
How do you get anything done with these two?
Well, we don't train them harder than us.
So actually, we should probably do this together, sorry. So relax, Ron, take it easy.
10 seconds in. Showing off.
And not crying, that's good. All right, so can you bend a little bit more for you? So the goal here also is you want to feel this in your glute, right? Not necessarily. We'll just take inventory of what you feel, actually. Forget that right now. All right, so up with 2 feet, come on up, butt up in the air, shift over to the left, and raise your right. Good.
There's too much weight there.
It's what you get all the muscles for, is to have weight. Good job, Jim.
Okay, and good. Take a break there. All right, we're going to come up again and go to your right. Okay, don't worry about the height, Ron. It's okay. You're fine low.
No, what I was worried about is I brought my left side. It caved in, London Bridge fell down.
It's an interesting way to brag about yourself. Calling yourself a bridge. Good.
Yeah, I would
Take
blow a few.
it. Good. That was good. Very good. All right. So, intervention 1 is the test. So what you'll do is, if you feel like just a 2-foot bridge, like so for Jim, 100%, I would just start get you comfortable with the 2 foot, and then I would start doing the shift over to the 1 leg. That's probably where you are, where you're like, hey, I could just go 80-20 to 1 leg, so I still have the balance component, and I can go up and down. Right? Does that make sense?
So we're going to lift my butt and put it down, lift it and put
Yeah,
it
can you think you can handle that? Yeah. So, but what you're going to do is just shift without doing the leg lift. Okay. So now I'm just loading one side more than the other, trying to work on it. Sometimes I'll do it like this, where I can kind of, I can push. And actually what I'll do is I'll push with some rotation to help me do that. Because you're not ready to do this, which is fine, you could do some sort of balance, whether it's straight leg or bent leg, to help you come up. Does that make sense?
Right, let's practice.
And then sorry, what was your name? Miranda. So for Miranda, she could totally do it. So one way that I do the one leg one, I'll just do this way, is I'll lift this leg up and I'll push my hand into this leg to help keep my core tight. And then I'm here. Because again, it's the same thing where I don't want to excessively arch through it. So what I want to do, tight, boom. And it just locks me into there. Cool? All right, so you're 2 foot, you're 80-20, and you're going to be 1. 10. At your own pace. There's no hurry here. So here, this is where I was kind of going earlier, you should feel this mostly in the glute. High hamstring, high thigh, into your butt. Yeah. Okay, if you feel it in the back or you feel it in your thigh and your hamstring totally, then we got to adjust a little bit.
Okay, let's talk about that.
Okay.
I just did a couple of them there just to test it out. And I could feel it in the glute, but I could also feel it out here in my wings.
Okay, yeah. So what I would do is try and tighten your abs a little bit before you lift.
Okay.
First.
I got it.
Let's try that. And then the second question, well, you're doing one leg also.
Yeah. Sort of what it was, wasn't it?
Okay. How does it?
Here. Or I could do this.
So that's fine, but where do you feel it? Right? If you feel it where I want you to, that's totally great for you to push into that.
I'm
But
feeling on the top of my hips this direction here.
yeah. So then I would probably regress it a little bit because I wouldn't bring your feet out more. Do you feel that throughout the motion or just at the top?
So that leg's going to stay flat. That right leg's going to stay flat on the ground. And then you're going to lift. Yep, there you go.
Well, I'm cheating. I'm going off my heel.
That's okay. That's okay. So come up on your left.
80-20.
Yeah, I'm cheating. Either 100%.
How'd that feel for you?
It's good.
It was okay? Okay.
100% of nothing. Yeah, Jimmy, how's that? Hard?
Yeah.
Yeah?
What you'll see when you do this way with the one leg down is you kind of naturally want to twist a little bit, and that's okay. So for you, you're going to come up and your hips are going to slightly turn towards me, actually, in that one.
Okay.
Okay, and that's okay.
Well,
And then back down. So just nice and easy. So my assumption, especially for you two, and even for you, because you're doing the one leg, is if later today or tomorrow you get sore in the back, it's probably because you did too advanced of a level on this one, right? So it takes some practice and some time to actually focus in and say like, hey, where am I feeling this bridge? Because most people just do the bridge and they go up and down really fast, right? I had an Instagram post on that this week if anybody saw it. So, oh, you saw it? Yeah, cool. So what I want to make sure is really paying attention, going slow through the exercise and seeing and trying to internalize, where do I feel this? Because everyone's going to feel it in some spectrum here, and you're just trying to figure out how do I best wind it up to target the glute.
there
And there. Yeah, and so that's my thing for you. I think that has nothing to do with your back. What it is probably because of the knees, right? So if you can't bend the knee fully to bring this back, obviously you're going to use your hamstring a lot more with this, right? And the opposite is true, is if I feel it a lot in my back, kind of like you did, maybe I'm bending my knee too much, right? My heel is too close to my butt sometimes that can happen. Although, again, I think more so for you, it's the ab position. Yeah. You have abs there. They're there.
Boatload, big muscle.
Okay, so does that kind of make sense there?
Yeah.
So I think that's kind of where you want to find it, and we'll come back and refer to the ab position there in a minute. So the other hip extension stability exercise is just kind of our quadruped series. So again, we can scale this to whatever you're comfortable with, right? The classic one is the bird dog, opposite hand, opposite leg. So this is kind of the classic thing we do. The way I start people is, again, I want to make sure that I'm in neutral, and then to make sure for balance, right, is going to be, I'm just going to do a foot slide. Right? So I just want to, when I'm introducing it, it's to there. And then I would go to lift off, right? But notice my back doesn't move. It's not this, right? Because that's a different exercise. What I'm working on is a stable core into that hip extension. Okay, does that make sense? And then you could go to here. And then maybe Miranda could even get into a car, right? Where you're coming up into here, around, right? So it's just a scale.
That's the one that I have extreme difficulty with. I'm a rafter.
Uh-huh.
So I've got 18-inch thwarts to crawl over to get up onto the dock.
Uh-huh.
I'm not doing very well on that.
Okay. I mean, there's a lot of reasons it could be, right? It could be strength, probably mobility as well. Yeah, and there's also the mental.
Yeah, I got it.
Yeah, practice.
So let's run through the series and we'll have you stop where it is. So everyone's gonna go through it from the beginning. So first, kind of find your comfortable position in your back. So kind of arch it and flatten it. Kind of find out where you want to be. And then let's see. So Miranda, I'm gonna have you bring your hips over your knees, and then your hands are gonna be underneath your shoulders. Yep. So yeah, that's good. That's good. So the first thing is just the toe drag. So you're gonna toe slide back. Boom. And really pay attention to your hips. So this toe is still on the ground, Jim. Yep. And then slide back in. So let's go back and forth 3 times. And this one should be relatively easy to control this. All right, so if you were to put this doesn't knock off. Miranda gets the harder one. Oops, sorry. So you get something like this. That works. Nope. This is a really long dowel, but so kind of go into there. Yep. Okay, don't let it fall. Yep. So after the 3, oh yeah, perfect. This will give you more confidence. Okay. So yeah. So when you're ready, you're going to progress to toe slide to lift. Jim and Ron are just going.
Good dogs.
So now, if you think you got this, especially on the bird dog, hold it there. Can you hold it there for 5 or 10 seconds? Tighten your abs, right? Squeeze that glute a little bit while staying square. Good job, right? Now try that the other way. Nice.
I'm not wheezing today.
Yeah, I know, no squeezy.
I took mine.
Switch.
And then
Miranda, go for the bird dog there. Miranda, you okay?
Yeah. I just got a cut and it's insane.
Oh. What's hard there, Miranda?
I don't know.
There's a lot of shaking going on.
Yeah.
Shoulders tight? Or maybe? Or just hard?
I don't know.
Okay.
Let me think about it a little bit more.
Okay.
That's the one that's cooking. Let's try and get it here. I think.
well,
Shoulder. Cool. All right, you guys can rest. You guys deserve it. Miranda, you do the cars one still.
Which one's that?
So that's gonna be here. Yeah. And then up and around, right? No arm. Yeah. That'd be impressive. But I don't think I could demo that, so then I won't make you do it. Yeah. So really try to stay so you can see it there. So maybe not quite as big of a circle for you. Yeah, there you go. Yeah.
he's finding better hydrants.
Fisherman.
All right. So
You blocked.
again, kind of take inventory of what that felt like, right?
Yeah.
And where you feel like you are on that scale, right? You guys are actually pretty good. So you guys could do the regular bird dog, I think, pretty comfortably. I'd be fine. Cars is probably, there's other limitations there that kind of limit that. And and the reason I say that, and it's not that it would be bad, but then you're just dumping into your arching, right? Your back here.
That's right.
In order to do it, because you can't, you're like, oh yeah, I could do it. Yeah.
Sure, yeah, but watch me.
Right.
Wiggle
You do
your
that
arms.
a lot, you're going to wear out your back a little bit, right? It's going to start to hurt a little bit. So I would rather you not. I'm going to stop you where you can control it, right? So you're like, you could do the cars, but you have to pay a little bit more attention to the core there.
It's a new activity, so you have to learn the process.
Right. And I think that's the mentality you have, is it's a skill, right? Because you could just roll through it, or it's like, hey, what am I actually trying to do? And a lot of these are just having a stable core, moving my extremity, right? Especially with the cars type concept, it's trying to isolate that hip joint, but what most people are going to do is they're going to twist through their low back.
Thanks for reminding me of that.
All right, so that's it on the assessments. What we're going to go through now is what I call like the lumbopelvic concept. And basically, this is what I take patients through on their first visit. Every time I have a low back patient, this is what I'm going to talk people through. Okay? So what you're going to do is you're going to lay on your back. This is the last kind of main thing we're going to do, and then we'll just chat to wrap up. Okay, so find your comfortable position there. I want you to bend your knees, Miranda. And so this is going to be, what we're doing is just a pelvic tilt to start, right? So we're going to shift our hips forward and back. And what I want you to think about is there's a clock on your belly, right? Facing up towards the ceiling. 12 o'clock is up by your sternum. 6 o'clock is down by your belt, your pubic bone, okay? And so what I want you to do is I want you to rock back and forth with your pelvis or your hip. So you're going to stay flat on the ground, and you're just going to move it back and forth. Okay, so if I was standing or laying down, this is essentially what I'm doing. All right? Does that make sense? So can you bend your knees a little bit there? What's that?
Do most of us have a baby?
Oh, sure.
You got a big old huge problem there. Because when I do
Keep the butt stays on the ground. So I don't want the butt to come off the ground. I want to isolate this again to my low back. What I'm trying to do is move my pelvis back and forth to make that feeling of I can control my spinal position, my low back position, by using my pelvis. Whatever my pelvis does, my spine will follow, right? It's right next to it. So if you think about the front of your pubic bone, or you think about your belt buckle in the front, and I flatten my back, so I tilt my pelvis upwards. My belt buckle comes up towards 12 o'clock position. And then if I go the other way, I tilt downwards, my belt buckle, my pubic bone tilts down towards 6 o'clock, right? And I'm just going back and forth between 12 and 6. And conceptually, in this position, this is my full range of motion, right? I can do the same thing in sitting. I can do the same thing in standing, right? Then, when we think about the concept, and your trainers have probably talked about this too, is neutral spine, right? We hear neutral spine all the time. I talk about neutral spine all the time when we do exercise. Neutral spine, in theory, halfway in between 12 and 6, right? So you wise guys, that's like 3 or 6 o'clock, right? Or 3 or 9 o'clock. But it's somewhere in the middle, roughly in that middle area. That's considered neutral spine. However, as we age, as we have injuries, right, or things happen to us based on our history, our jobs, etc., activities that we like to do, what we like kind of changes. Our neutral changes, right? And we may have a bias to a 12 o'clock or 6 o'clock, right? And so depending on what that injury was when you get hurt, we're going to have a preference of where we want to be. And so for you, when you're like doing a deadlift, trying to internalize where am I comfortable most likely, and can I maintain that throughout that movement? Or am I dumping into too much extension potentially on the way up or something, would be my question, right? So again, for you guys individually, going between 12 and 6, think about how you feel in each of those positions. When I go all the way to 12, what do I think? What do I feel? When I go all the way to 6, what do I think? What do I feel? Do they both feel fine? Do they both hurt? Does one feel better than the other? Do I just feel better when I'm not in the end range? I'm more in the middle, right? And that's going to preference where you want to be when you're doing exercises. So this is something, again, I'm doing this day one with patients to help them control their pain, control their inflammation, is figuring out what I need to do. Now to take that one step further, in normal day-to-day function, if I sit, right, you're going to sit on your sit bones, and what am I going to do? 12 o'clock. This is a natural tuck flexion, 12 o'clock position, right? It's not good, it's not bad, it's just what we naturally do. You can pretend and try to have really good posture and sit and do stuff, but you're always gonna come back into this because this is natural, right? But then when we stand up, what am I gonna do? Naturally tilt down towards the 6 o'clock, a natural arch.
Your knees under you.
Yeah, exactly. And when I walk, same thing, 6 o'clock with some twist, with some rotation. So when people come to me and they tell me they have back pain, that's literally what I'm thinking. I'm going through that in my mind and seeing what they need to do, right? So Pilates is saying extension, 6 o'clock is painful. All right, I'm just gonna slam people into 12 and train them away from that, right? And they're fine. So that's part of what you need to do. When I hurt my back last weekend, bending over, rolling, right? I was in 12 o'clock bending. And so what did I know I need to do? I need to get into 6. Man, smart guy, right? So that's what I need to do. So I knew I needed to get vertical, number one. And when I got home, I needed to get on my tummy, right? And that's all I've been doing all week, right? And that's literally how, as a PT, we would just control it. We're a little bit more in tune with ourselves to do that, but that's what I would do. Does that make sense?
So this is another one that I'm working on a golf deal. When I'm
Okay.
sitting down there and I'm coming up out and I'm rising away, I generally take a second step after the swing because I'm off balance.
Yeah.
So this thing right here is really important for me to stop taking that first little hop.
Yeah, yeah. I mean, my guess too would be a mobility issue in the hips and the upper back, thoracic spine. Yeah. Well, that's a whole nother. I don't do that kind of therapy.
Kill the crap out of that ball, you know?
Yeah. And I mean, could it be a core stabilization thing, hips and core? Yeah, absolutely. But, but I think there's a huge part of that where it's like, golf is so much rotation. And if you don't have it, your body's compensating to do it, right? You're a bigger guy, you're a stiff guy. So that'd be where that's what's going to really make you feel better is more mobility.
I need to not do that.
Yeah, exactly.
Well, it's gonna come from your thoracic spine that we've worked on.
Yeah, we've worked on that a lot,
Yeah.
and it really helps me for accuracy.
Yeah. Shocker.
Because before I used to be pretty entertaining.
Yeah. You still are, as far as I'm concerned.
No, I introduced myself.
Just a different kind of entertaining.
New Forest and hi, I'm Ron over here today. Jesus. Yeah, it was really poor when I started out.
Gotcha.
Seriously goofy.
So the last thing to talk about is just kind of the hinge concept that we get to just talk through real fast. And that is, again, we get that fear avoidance. People don't want to, right? Anytime I treat somebody post back issues and such, and especially if I see them longer out where we're actually trying to get back to normal exercise routines, they don't want it, right? They're gonna deadlift like this, right? They're not gonna do it. They don't want to, right? But the reality is it's so important because again, I don't want to do this a ton when I pick up my kid over and over again. Like that's not going to be good, right? Especially if I twist, right? What's much more easy, what's more comfortable and safer for me is this, is that hinge, right? This is why PTs and trainers emphasize the deadlift and the hinge movement so much, is because it's completely functional. I would much rather do stuff in this range as opposed to this. I'm going to pick something off my couch, right? Freaking toys that I'm cleaning up all day long, right? I don't want to do this. I want to get into here. If I can do it, if I'm kneeling on the ground, like, so this whole week, what was I doing? This is like great examples because I had to do this past week, was I'm hinging in a kneeling position, right? I'm not bending over, I'm hinging, right? I'm in half kneel, I'm hinging to pick up my kid, right? Much, much more tolerable than if I'm just constantly flexing.
Aging too is one of the things that's really hard to get out of a low chair.
Yeah.
Like that chair right over there kills me. I
Yeah.
gotta get scooted
That's
up.
low. Yeah.
And I got to tip to get over my knees, and then I can do that.
Yeah, because you're incorporating more, for you, just isolating a quad like in a squat to stand, like how I would stand up, that's a lot for you, especially from a low position. So you bend over to get your glutes and your backside involved to help you stand up. Absolutely. Yeah, totally. And I think that's why you would teach people, right? We teach people as we age to get out of a bed, hey, let's use more of our body to get in and out of it, if that makes sense. So to me, I think, when you work with Tip and Tara and the other trainers, there's a reason we practice that hinge. I'm not saying you need to deadlift 300 pounds, but like you just need to be able to do the movement and understand where you are. So if I'm going into 12 and 6, right, wherever I need to be, boom, find where I'm comfortable, and then can I maintain that, right, in and out. But if I kind of go into this position and I flex, And then I get to the top and I'm like, here, right? That's where you get sore. Right. And so it's the ability to say, can I keep this tight as I move in and out, right? Which again takes practice. That maybe I cut back on weight or volume or the sets aren't 10, they're going to be 3 to 5 because I can focus easier on the technical aspect of that. That's where I'd want to be. But it's a really good thing. I just have people all the time, wall at my house, push, right? I'm not no weight. I'm just getting myself comfortable here and getting that stretch on the backside. Right? And that's fine.
That's a good one.
Okay? So I think that's really, really helpful to kind of just practice. Again, it's practice. It doesn't have to be this huge exercise thing.
Yeah.
Cool?
Nice bench.
Yeah. So that's it. That's kind of the workshop. That's kind of the nuts and bolts of all the stuff, the basics of the back stuff. I hope that was kind of helpful. You got some tools that you can start doing right away. And, you know, again, I want you guys, and I encourage people always at the end, is to say, you know, go get the help. If you need help, right? If you have nagging injuries, if you have a ton of stiffness, all those things, go get that stuff addressed before it becomes chronic, right? It's much easier the sooner in the process to treat it and work on it, the sooner you do it. So, but if you wait weeks, months, years, decades, some of us, for doing this to get it to PT rehab, way, way harder, right? There's a lot more stuff that we have to work on to do that. And I'm not saying work with me. If you have somebody you trust and you like and does a good job, use it. Whether it's a PT, chiro, acupuncture, massage therapist, whatever, whoever's in your wheelhouse, use those people. Part of me being here is, I can be a resource for you. I'm happy to do that. You know, part of getting out of the traditional medical system is to be, again, just like you guys, proactive in the healthcare system instead of reactive, right? Instead of coming to see me once you are hurt and once you have issues, see me on the forefront, right? Hey, let's check this out. Every PT's dream when we're in school is to say, hey, why can't we have annual physicals, right? You go to the doctor annually for your physical. Why not as a PT, we do that and we say, hey, we're going to do a joint mobility assessment, flexibility, mobility, strength, looking at some of our movement, maybe a hinge or whatever, to say, hey, let's catch these things before they become a full-blown issue, right? And that's what I like to do, right? And so that's part of the proactive nature is doing workshops, getting the community, and then like saying, hey, let's do this. Let's find ways to do that. So again, that can be me, that could be another therapist or chiropractor or et cetera that you like. Great, do that. You know, and so with that said, what I do for the workshops for you guys is I say, hey, to help facilitate that, I offer half off a session for the first initial evaluation for the next couple weeks after a workshop. So for all of you that are here, on camera, whatever, the next 2 weeks, if you can get in or contact me at least, I'm happy to help you and try and get you in for an initial session. Cool. All right, so that's it. Thank you guys. And I'll stick around and answer any questions you guys have.
Hugs.
Hugs, yeah. I'm from California, dude. I hug, it's fine.
Yeah.
Cool, thank you guys.
All right, thanks for being here at PDX Fitness today. This is cool.
You're decked out.
You guys learn a lot, Ron?
Remembered more than I learned. But I did get 2 good teachers.